Dear medicos, welcome to my YouTube channel, Indian Anatomist. Today we will cover the anatomy of the sciatic nerve and its clinical aspects. Before discussing the sciatic nerve, let me talk about a brief introduction to the sacral plexus. What is sacral plexus? The sacral plexus is a network of nerves that provides motor and sensory control for the lower leg, foot, thigh, and part of the pelvis. The sacral plexus is formed by the union of the lumbosacral trunk, that is anterior primary of L4 and L5 joints, with the anterior primary rami of S1 to S4 spinal nerves. The sacral plexus gives rise to many small branches with one thick and long called nerve, sciatic nerve, which is approximately 2 centimeters broad. The smaller branches from the sacral plexus are nerve to Quadratus Femoris, Obturator Internus, levator rami, and Piriformis, then pudendal nerve, superior and inferior gluteal nerves, and perforating cutaneous nerve of thigh. The sciatic nerve is the largest and thickest nerve that arises from the sacral plexus. The sciatic nerve is a mixed nerve that contains both motor and sensory nerve fibers. The root value of the sciatic nerve is L4, L5, S1, S2, and S3. Origin-wise, the sciatic nerve consists of two parts, tibial and common peroneal parts or components. Tibial part arises from the ventral divisions of anterior primary rami of L4, L5, S1, S2 and S3. Common peroneal part arise from the dorsal divisions of anterior primary rami of L4, L5, S1 and S2. Let us discuss the course of the sciatic nerve. The course of this nerve is seen in the pelvic cavity, gluteal region, and posterior compartment of the thigh. First, we will look for the course of the sciatic nerve in the pelvic cavity. The sciatic nerve is formed in the pelvic cavity. It successfully exits the pelvic cavity into the gluteal region through the greater sciatic foramen. Please follow the illustrations side by side. The nerve lies anterior to the piriformis muscle in the pelvic cavity and curves downward and laterally. Next is the course of the sciatic nerve in the gluteal region. The sciatic nerve appears and runs inferior to the piriformis muscle in the gluteal region. Further, it runs downwards between the greater trochanter laterally and ischial tuberosity medially. Later the sciatic nerve crosses the inferior border of the Gluteus Maximus muscle and enters the back of the thigh. In the gluteal region, it is related, superficially or posteriorly to huge quadrangular-shaped muscle, the Gluteus Maximus. But deeply, the sciatic nerve is related to many structures. They are body of the ischium bone, and several muscles are superior gemellus, Obturator Internus, inferior gemellus, Quadratus Femoris, Obturator Externus, and upper fibers of Adductor Magnus. Students, this animated illustration shows the series of muscles located deep in the Gluteus Maximus muscle. Here the sciatic nerve is not seen, instead the muscles present superficial and deep to it are visible. Deep into these muscles, the nerve is also related to the posterior aspect of the fibrous capsule of the hip joint. At last, the course of the sciatic nerve in the posterior compartment of thigh. The sciatic nerve enters the posterior compartment of the thigh by leaving the inferior border of the Gluteus Maximus muscle. In the posterior compartment of the thigh, the sciatic nerve runs vertically downwards between the long head of the Biceps Femoris muscle, superficial, and the Adductor Magnus muscle, deep. In the posterior compartment of the thigh, the sciatic nerve's medial half is considered tibial component, and its lateral half is common peroneal component. Then, the sciatic nerve descends vertically down in the posterior thigh to the superior angle of the popliteal fossa. Now, what is popliteal fossa? Popliteal fossa is a diamond-shaped, intermuscular space situated behind the knee joint. Popliteal fossa has 4 angles: superior, inferior, medial, and lateral angles. Near or at the superior angle of the popliteal fossa, the sciatic nerve terminates by dividing into 2 terminal branches. Tibial nerve runs vertically downwards, and common peroneal or fibular nerve that runs laterally downwards. The tibial nerve is a mixed nerve that supplies the posterior compartment of the leg and sole of the foot. The common peroneal nerve is also a mixed nerve that supplies the lateral and anterior compartments of the leg and dorsum of the foot. Dear students, Now I have discussed the normal course of sciatic nerve. However, in some individuals, the sciatic nerve shows variations in the termination. According to the literature, there are 6 types of sciatic nerve bifurcation, or termination recorded till now. Students, please see the illustration for easy understanding. Number 1 is that the bifurcation of the sciatic nerve occurs in the pelvic region itself, so the tibial and common peroneal nerves start their course from the pelvis itself. In this situation, the tibial nerve runs inferior to the piriformis, whereas the common peroneal nerve frequently pierces or passes through the piriformis muscle, and is the common site of nerve compression, causing piriform syndrome. Number 2 is the bifurcation occurs in gluteal region, but under cover of Gluteus Maximus muscle. In the third variety, the termination of the sciatic nerve occurs in the proximal, middle, or distal third of the posterior compartment of the thigh, and the fourth one is termination in the popliteal fossa. Dear students, the course of the sciatic nerve is completed. Hope you understand. Now, we will look into its branches. No branches given by the sciatic nerve in the pelvic and gluteal region. In the posterior compartment of the thigh, the sciatic nerve gives both muscular and articular branches. The tibial component of the sciatic nerve gives muscular branches to the long head of biceps femoris, semitendinosus, semimembranosus, and hamstring part of the adductor magnus. These muscles are commonly called hamstring muscles. This branch also gives an articular branch to the hip joint. The common peroneal component of the sciatic nerve supplies only the short head of the biceps femoris. Finally, the sciatic nerve terminates by dividing into tibial and common peroneal nerves at or near the superior angle of the popliteal fossa. Now it is the time to discuss the clinical anatomy of the sciatic nerve. Injury to the sciatic nerve results in paralysis of the hamstrings, paralysis of leg muscles including its anterior, lateral and posterior compartments, and foot muscles. This causes the foot drop. Sensation would be lost over the leg except its medial side, and dorsum, sole, and lateral side of the foot. The sciatic nerve is commonly injured during intramuscular injections into the buttocks or gluteal regions, or the sciatic nerve may also be injured by posterior dislocations or fractures of the hip joint. Piriform syndrome. People with piriformis syndrome have pain in their sciatic nerve because the piriformis muscle presses on it. It's more likely to happen to women and people who do sports that use their gluteal muscles a lot, like ice skaters, bikers, and rock climbers. Nearly 50% of the cases show gluteal injuries with piriformis spasm and hypertrophy. In 12% of persons, the piriformis may compress the common peroneal branch of the sciatic nerve, especially the pelvic division of sciatic nerve, whose common peroneal branch passes through this muscle. The next clinical anatomy is sciatica. This is a common term heard in lower limb nerve injuries. This is due to the compression or irritation of the sciatic nerve. It is characterized by pain in the ipsilateral or affected buttock area that radiates down the lower extremity, usually caused by herniation in the lumbosacral region or direct or indirect trauma to the nerve, mostly by bone spur. The clinicians or physicians are usually advised to perform an imaging procedure, usually an MRI. Most sciatica are treated conservatively with rest, pain medication, and physical therapy. More serious injuries to the nerve would require surgery. Sciatic nerve pain may come and go, or it may be chronic or long-lasting. Sciatica cause burning sensations, muscle weakness, numbness, sharp or shooting pain, tingling or pins and needles sensations. Often, sciatic nerve pain worsens if you stay in one position for long periods, or herniation of semimembranosus bursitis, or Baker's or popliteal cyst on the posteromedial side of the knee, may enlarge in the midline. This enlarged, unruptured bursa may compress the lower sciatic nerve and may produce the sciatic neuropathy. Occasionally, an individual may be awake while experiencing a sensation of numbness in the foot. This is due to the compression of the sciatic nerve in the posterior thigh, where the nerve lies between the long head of the biceps femoris and adductor magnus and rigid femur bone. The sciatic nerve is compressed between the femur and the rigid edge of a table, chair, or bed. Numbness in the lower limb persists until the foot contacts the ground several times. The sensations return. This condition is also called sleeping foot. Dear students, I hope you've all understood the gross and clinical anatomy of the sciatic nerve. If you have any queries, please use the comment box. Please like, share, and subscribe to my channel, Indian Anatomist. Please click the bell icon to receive a new video notification. Good day, everyone.